day, ma'am. I'm Marison Dimangay from BSN2C. For today's video, we have to perform applying topical medication. First, gather all the equipments. And then check medications order against the original physician's order according to agency policy. And then clarify inconsistency, check the patient's chart for allergies. And then know the actions, special nursing considerations, and then safe doses, ranges, purpose of the administration, and then adverse effect of the medication to be administered, and then consider the appropriateness of the medication for the patient. And then perform hand hygiene. And then prepare medicine for one patient at a time. Read the medication administration chart and select the proper medication from the patient's medication drawer or unit stock. And then compare the label with the medication administration record, check the expiration dates, and perform calculation if necessary. And then when all medication for one have been prepared, check the label with a medication administration chart before taking them to the patients, and then return the medication stock to patient's drawer. And then transport the medication to the patient's bedside carefully, and then keep the medication in sight at all the times. Ensure the patients receive the medication at the correct time. And then identify the patient. Usually should identify the patient using the two methods. Compare information with the medication administration record. Check the name of the patient identification band. And then if the patient cannot identify him or herself, verify the patient's identification to the significant others. Good day, ma'am. I'm Marison. I'm 11 years for the day. What's the name of the patient, ma'am?
Karel Destin.
Complete the necessary assessment before the administering medication. Check the allergy bracelet or ask the patient about the allergy. Do you have any allergy in topical medication, ma'am? Okay. And then explain the purpose and action of each medication to the patient. In topical medication, ma'am, is I will administer her topical medication to remove the skin lesion. Will be alright with you, ma'am? Okay. Perform hand hygiene. And put on gloves. Gloves unless the skin is broken, and then apply sterile gloves. Wash and rinse and dry the affected area with water, and then clean gauze pad. If the skin is very dry and flaking, apply topical medication while the skin is still damp. And perform hand hygiene, and between use sterile gloves for open skin lesion. of the cotton tip applicator is sterile and it is for single use only. Let the patient know that the initial applicator feel cold. Ma'am, ito pong i-apply ko pong topical medication is malamig. Medyo po malamig pa. Ilang po ba? Ilang po ba? And then, apply the medication using one stroke and observe the inner to outer application. And then, observe sign of irritation and redness. Perform hand hygiene. Komportable na po ba kayo, ma'am? Okay. And then document all the procedure in the patient chart. That will be all, ma'am. Thank you.